Hi, everyone. Welcome to Women Entrepreneurs Radio, and I'm your host, Deborah Bailey. Really glad you could join me today. And if you're listening to this on the podcast directory, you're listening on iTunes, you can come back to blogtalkradio.com/CoachDeb, and you'll find an archive of shows going back to 2008. So you can download shows from there. You can listen online and also share on social media, which I hope that you will do. Also check the Facebook fan page, Women Entrepreneur, Facebook.com /Women Entrepreneurs. You can stop by there, like the page. And the blog, Women Entrepreneur Secrets.blogspot.com. It's a companion blog for the show, so also we'll have show bios on there of the different guests and links to pages, Pinterest, and different social media. And also, if you're interested in being a guest, there's information on there as well, advertising, promotions on the blog or the show. And if you want to share any articles or announcements of interest to women entrepreneurs, you can also contact us there as well to find out about doing that. So I hope that you will. And also my website, DeborahABailey.com, is a place you can find out more about me and my books and different things I'm doing. So that's a good place for you to stop by as well. So I hope you will check it out. Okay, so we're going to get started with my guest today. And Danielle Wilson is President and Chief Executive Officer of Aero Jet Medical, an all-inclusive provider of worldwide air ambulance transport services. And with over 2 decades of air medical experience, Danielle possesses a broad range of proficiency and business acumen to ensure Aero Jet Medical provides every patient with clinical excellence and operational expertise. Compelled by her passion to help others, Danielle began her accomplished career in medicine at the age of 21. In addition to Aero Jet Medical, Danielle is also the president and CEO of sister company United Medevac Solutions. Self-termed a global nomad, Danielle has a passion for exploring new cultures during her extensive world travels. So welcome, Danielle. Really glad to have you here today.
Thank you very much. I'm glad to be here.
That really sounds really interesting. So, if you could start by sharing with everyone, how did you, have this journey that you did to bring you to where you have these 2 companies?
Well, ironically enough, as in my bio, it states I started my medical career at the age of 21 whenever I became a registered nurse and concentrated on emergency medicine, which then led to a career as a flight registered nurse for over 10 years. And within that, in development, I was actually slotted into a business development role for our air medical program. And from that, it certainly exposed me to a variety of settings, not only clinically, but also the business side of operations.
So, could you describe a little bit about those companies? Because, you hear some things from time to time about air evacuations and that sort of thing, but I've never met anybody who is in that industry. So could you share some about those companies?
Sure. Our initial parent company, United Medevac Solutions, originated in 2005. It was during the time that the Army was at war and needed a lot of their assets that they had here on the state side. They needed those overseas. And that it left a your ambulance needs here in the U.S. And so with that, they looked for the commercial sector to try to make that coverage. The current hospital group that I was working with was not interested in dedicating an additional aircraft to that area, but realizing the opportunity. And, I decided to move forward with that since I was in the industry and certainly had a significant network to be able to pull from. And I took the risk and I moved forward with that. And we got our start in 2005 by being the first commercial, privately contracted air medical service for the Department of Defense.
Wow. So that sounds like a really big job. So, is it really as involved as it sounds?
It really is. I say with United Medevac, we do 100% contracting work for the Department of Defense. Even 10 years later, that's our primary goal with United Medevac Solutions. And we've just recently, in the last couple of years, added the component of international air ambulance because we recognize the need, not only because there's more and more international travelers, but in particular, as the world is more interconnected and more people are deployed overseas, the need is there to get them back internationally. And so that's when Aero Jet Medical was created, to not only to meet that need to get people back.
Mm-hmm. Wow. It's, like I said, it's something that you may see on TV that looks so dramatic or maybe hear about, but, it's hard to imagine how it must be to, be involved in something like that and something that certainly is helping, with troops and people who really need it. It just seems like it'd be such meaningful work, but also kind of exciting at the same time.
Well, it is certainly a little of both of that. Logistically, it is very challenging, trying to not only organize the entire portion, but to make sure that assets are available, that medical personnel is available. It's very encompassing, but like you said, it is incredibly rewarding when you do have a successful mission and you're able to reunite that injured patient or soldier back to the stateside and also to reunite them with their families.
So, when people decide they're going to need your services, does that depend on that they just can't get the right care where they are? Or is it just that an individual may, they may say, well, we've got to get back to this place for this person to be cared for. What really usually triggers them, calling on you to provide your services?
Well, it's a variety of situations can certainly develop and happen. Most of the time when people travel internationally, as you know, the United States has the best medical care worldwide. And so if somebody has gone, say, even something as simple as vacation, and they suffer some type of injury or illness, they're certainly stabilized as much as possible wherever they may be located, but certainly the amount of medical care that's available, there's a great diversity from one country to the next. And so most of the time it's getting that person, once they've been somewhat stabilized, basically arrange them for transport to get them home so they can get a higher level of care. And then the other portion of that is sometimes the care can be appropriate where they may be. However, there may be long-term medical issues that have to be addressed, whether it's rehabilitation or, even therapy, that patient and those families need to be relocated back to their home base so they can have some sort of normalcy in their quality of life and their daily routine.
Wow. Yeah, I've only seen, I guess, something like this once where there's a park here that's near, right across from St. Peter's University Hospital, and they came through and closed all the roads, and then we were just kind of wondering what was going on, and then suddenly a helicopter lands in the middle of the field, and they just bring the patient and take them across the street to the hospital. I've never quite seen anything like that, but, I figured, well, okay, I guess they've got to land somewhere when they bring someone in, but it was just so dramatic, the whole thing that happened, and this helicopter just lands there in the middle of the park.
Yes, ma'am.
Yeah.
In helicopters, 911 helicopter service, that truly is for emergent care and emergency type of response. Aero Jet Medical does long-distance air transport, so that's anything over 150 air miles. It's not appropriate to use helicopter, not only due to the expense, but the time lag that helicopters have a very defined area circumference flight that they can project. And many of these patients are coming from other countries. or traveling from one state to the next to get appropriate care.
Mhm. Wow. So what is a typical day like for you?
Well, I always it really just depends on what the day holds, and that's part of the exciting part about the job is it is not the same every day. I always go into the office with great intentions, and I always have pre-planned the night before.
Of course.
I call it my chronic to-do list. Really, it always becomes crisis management 101. So as things happen, you prioritize and then reprioritize and reprioritize. And, the typical day is always something different. I do try to have a routine so I can try to maintain some organization and some order to my day. But I'll tell you, most of the time, it does not go as planned. But that's okay. That's the part that keeps it exciting for me.
Exactly, I'm sure. Something like this is very hard to plan what may come up, but being able to deal with all of that and keep things going, it takes a lot. Do you also work with any family members on the job?
Oh, do I work with family members? Yes, I do.
Yeah.
My husband actually is our chief operating officer for both companies, and that has worked out incredibly well. He comes from a very strong operational background. He was also a flight paramedic for a number of years. And so he brings that operational piece because simply I can't do it all. And there's certainly no one that I know that I would trust more to head that up for me. And so he's been extremely helpful.
Wow. So how does it go when you're working with a spouse? Is it more challenging, when you're not at work or not, working in the business? Is it more challenging to have that relationship?
Absolutely. I think so. Honestly, we just celebrated our 10-year anniversary, our work anniversary for United Medevac Solutions. And I can tell you the first couple years was very challenging for us, and truly because we're both very type A personalities, and we have been bred to be very decisive and committed to our decisions. And so during that first 2 years, trying to find his place and what his strengths are and where my place is and my strengths. And after the first couple years, we figured it out, and we've worked together, and we're very dynamic, with each other.
It sounds like the type of business where you have to have definitely a type A personality too.
Oh, absolutely.
So I think that's an advantage. But then you put two together. That's very interesting. So it sounds like you found a great way to make that work. So, what are the things that you really like about what you do?
I think the most intriguing part for me is, and I think that my nursing background has helped prepared me for this, is problem solving. I almost view it as putting the pieces of a puzzle together, and at the end you have a beautiful piece of art, for lack of better words. But it's the problem-solving portion where you have to take an unclear situation. You have to listen with a very open mind. You have to analyze things very objectively, not only make a decision, but then devise a plan and then institute that plan and to ensure and execute its success. And so at the end of the day, when you have a successful mission and the patient's taken care of and the family is so thankful, that is very gratifying to me to know that, even though you've worked 12 hours to accomplish this straight, at the end of the day, it's about the patient. And that's the positive for me. That's my favorite aspect.
Well, that's true, because I know that they appreciate that. family members, and the person going through is definitely going to appreciate being taken care of, because in that kind of situation, you need medical help. It's stressful, it's scary, and just to know that you're looked after, that has to go a long way to help people not to be more agitated and upset and whatever.
Sure.
Yeah.
Yeah, well, they find themselves in a position they're completely out of control.
Yeah.
And, in a total state of chaos.
Mm-hmm.
And all they want to do is come home and get the best care for their loved one.
Mhm. Exactly. So that can be a very scary time. So it's things like, looking after people and their needs becomes so much more important in that situation.
Absolutely.
So, when you're going through that and you're stressed and you've had a long day, what are some things you do to just kind of get yourself regrouped and energized again?
Oh, I think after the end of the day, for me, it's about family.
Mm-hmm.
And, I'm not the best at it, I'll tell you, but trying to achieve that balance of, truly being able to turn off some of the work portion and concentrate on family and having other outlets, like exercise and music and, visiting with friends, just it's work-life balance. I think everyone struggles with that regardless of what their position is.
Mhm. Exactly. And I think for type A people it's even harder to do because you're very determined to, get certain things done a certain way, and then trying to relax can sometimes be very difficult to do.
And I have to tell you, that's been something that I've had to learn over the years.
Yeah.
Because truly, your work can never be 100% complete. There's always something to be done. So, trying to learn how to run a business and not let the business run you. And there's a fine line with that because you're so driven to succeed.
Yes.
But you do have to, have that line that you draw, and there has to be some sort of balance on both sides.
That's true. And I think, a lot of times business owners just push themselves so hard, to get out there and to get success, and it's just it's never ending. And then you can just end up burning out so much because of so much that you're putting into it. I think.
Ma'am.
Yeah, that makes it so hard for people after a while, because then your ambition sometimes can keep pushing you to keep going and going and going, and then for some people they kind of lose why they went into it. They lose that dedication or the love for what they're doing because they just push themselves so much, just for the success alone, and forgetting the idea that brought them there.
Yes.
So, yeah.
And I'll tell you, occasionally, the other thing that I do, and not near as often as I would like to, but occasionally, I'm still a practicing registered nurse, and I uphold all my certifications and continuing education. Sometimes I'll go and actually be the nurse on the flight, and that is a very welcome break for me.
Wow.
Because direct patient care, that is my passion, and that's my history, and so for me that's like a vacation from the office, and that also is extremely gratifying to me.
Oh, I'm sure, because you can really connect with the person, and right there, it's not something so far away from you, and
that's correct.
Yeah, I think for some people that as they grow their business, they may kind of get disconnected from what they're doing.
Do.
Yeah, and it stops being a personal thing, and it's just like numbers on a sheet or something, and then they kind of lose that part of themselves. So, yeah, and you can kind of reconnect right there to see what the whole point of what you're doing is. It's right in front of you.
That's right.
So, yeah, that's really tremendous. But, for some people listening to the show, will be people looking to go into different businesses or careers and just not sure and wanting to make a change. Do you have any advice for anyone, or a young person who wants to go into what you're doing or just not sure where they belong, what are some things that you could recommend to them from your experiences?
I think the one thing that I would say is whatever position or job category you're currently in, I would advise to take advantage any and every training and educational opportunity that you may have, even if it's outside of your current career field, because you really never know where you're going to find your passion, and you never know where you may have an idea and be able to be an innovator in a completely different field. And I would say to certainly read, attend educational seminars, training, just make yourself the most well-rounded person that you possibly can. And the other thing, particular for women, I would say don't be afraid to take risks. Don't be afraid to take risks, and don't be afraid to advocate for yourself. Many times women don't do that. We're socially kind of taught since we're young that it's not nice to kind of boast about yourself. However, when you are competing in an open market, you have to advocate for yourself, and you have to take risks just as much as your male counterparts do for you to be successful.
That's true. That's really good advice, because a lot of times women will hang back, or they just feel like they shouldn't say this or that, what they're doing, or put themselves out there. And it always seems like there's a gap for women business owners to really be willing to stand up, say this is what I'm doing, and I have strength and belief in yourself and the courage that is there. But I guess to put it out there, I feel like you shouldn't. You're boasting, or somehow being a stereotypical, overbearing, woman or something, that you've been made to think that you shouldn't be. So there's a lot of stuff there that people, really have to get out of the way before they can really say, okay, here I am, and I'm doing a great job, and putting this out here to help people. So, you can't hide that.
No, you can't. And honestly, I think now after many years of doing this, I think that there's certainly a way to advocate for yourself, but still be tactful and do it with a woman's finesse.
That's true. That's very true. It definitely can be done, and you don't have to hide what you're doing and what you're passionate about. There's definitely that doesn't work, because especially if there's people who need what you can do and they don't know about it, because you're kind of keeping quiet or being withdrawing as you don't feel comfortable being out there. So I think
And the one other thing that I would mention when you talk about advice, particularly for women, I would say network. Network. There is power, particularly in women bonding together, and there's some incredible networking agencies that are out there, and you never know who you may need to call upon in the future. And relationships are one thing that takes time to develop, and they need to be real and genuine. And I think networking is probably another huge part of advice that I would give to any entrepreneur that is looking at the possibility of starting a business someday.
Yeah, I totally agree. I think that's something women do very well, connecting and communicating, and you really need all of those things when you're going out there, because the model, a lot of people have the male model of business, in mind. You've got to go through and be boisterous and push everybody out of the way and whatever that, what we thought it was supposed to be, and it really is not the way to go. You can be successful doing it your way, in a different way, and still, do something that is, build something that is successful and really contributes, because a lot of women want to be able to do that as well. And I think it's not something that's either or. We
that's
can
right.
do that. So I'm seeing more women out there doing that or hearing about them, not like they haven't been out there, but hearing more about them. It's really encouraging, especially for younger women to see and realize that, yeah, I can do that too. So I think that is fantastic. So, we have a little less than 5 minutes to go. Could you please let everybody know where they can find out about more in your company?
Sure, absolutely. Our website is iflyajm.com, and we're available on the website, and then, of course, on Twitter and LinkedIn and Facebook and all the other social pages. For United Medevac Solutions, that website is umsinc.com, and again, also on Facebook, LinkedIn, and Twitter.
Great. Yeah, now it's not just website, it's, every social media. We've got to be everywhere.
Yes, it is the time, that's for sure.
Yeah, more places you have to be. So, what has been the proudest moment for you in your career so far?
I think when we were able to institute the very first privately contracted, fully dedicated medevac special operations team for the Department of Defense, I took great pride in that, because not only was it the first time in history that had been done, but led by a female, and I had a fantastic group of people, and every one of us, we made that leap, and we made that, we responded to that challenge, because it was a way for us to serve our country in a civilian role. And, of course, that was, when emotions and patriotism, of course, was extremely high in the country. And I think that was my proudest moment, because we laid new groundwork, and that's something that, collectively as a team, we can take pride in.
And that's excellent. Also because it's something that she said wasn't done before, and that's another example for people to see, business owners or people who want to start a business, that just because it may seem like, oh, can I do this? This is something that hasn't been done. I don't know if I can. That kind of thing can stop so many people from putting something out there that's really needed, because they doubt themselves or doubt that it can be done, and they feel like they're not up to the task. So, just showing that, being that example, other people can see, I've got something here that I can put out here that could be of help, be of service. Not just to doubt it and not put it out there. You think about how many wonderful ideas just never have seen the light of day. Because of fears and doubts and thinking you can't be the one to do it. And,
I think you have to dream big to achieve large. So
Yes, I totally agree. That's fantastic. I like that. We always need we need that reinforcement a lot of times, because there's a lot of times people just feel like, oh, can I do this? Can I keep going? And that's such an important part of this show, to have entrepreneurs like yourself to show what can be done and give hope to others who have wonderful ideas as well, that they want to serve and contribute and put their ideas out there. So we have about 30 seconds left. Do you have any final thoughts on your business or on women entrepreneurship?
Well, I think that I'll refer back to probably the best career advice that I've ever received, and that came from my father, and it's very simple, but it holds very true, and he's always told me to be genuine, be honest, and always be on time.
I like that. Yeah, the being on time, a lot of people have problems with that. Definitely have problems with that, I think, but I love that, because that just is everything right there.
It is.
It really is. That says it all. For anyone who's wondering what's the secret to success, I think that covers it. So I want to thank you so much for being on the show. It's gone by so quickly.
Thank you.
It's like I thought it seemed like we just started. So thank you so much, Danielle. This is just fantastic work, and I want to thank you so much for what you do and contribute. Thanks so much for joining me today.
Thank you, Deborah. I appreciate it very much.
You're welcome.
Take care. Bye-bye.
Too. And everyone, I'm sure you have enjoyed this show. Please make sure you share it on social media and tell your friends to listen in. And, as I said, download the show, let everybody know, and listen again and learn from all the wonderful entrepreneurs who stop by to share their expertise and their stories. Once again, it's Women Entrepreneurs Radio with your host, Deborah Bailey. Thank you so much for joining me, and we'll see you again next time. Bye-bye now.